Hi class, I know that some of you are currently pregnant or you have a wife who is pregnant. Many of you in this class have had children, so this is just a little review about pregnancy, especially in regards to exercise. Back in 2002, the American College of Gynecologists and Obstetricians began to recommend that pregnant women should exercise moderately for at least 30 minutes most days, if not every day. Obviously, there's going to be some people who have conditions going on in pregnancy that are told not to exercise. But if your physician has cleared you for exercise, it's definitely something that is recommended. When you are pregnant, there's some changes to your body that can affect your ability to exercise and do activities around the house. One is your altered center of balance. As the baby grows, you have more of your body weight towards the front of you, so that can make you a little more clumsy. You're more likely to fall, lose your balance. When you're pregnant, you have an elevated resting heart rate. Your heart rate during pregnancy at rest is usually at least 10 to 15 beats higher than your normal resting heart rate. It's more likely you're going to get short of breath when doing simple activities, especially towards the end of pregnancy. And you have an increased chemical in your body called relaxin. This allows your joints to relax in preparation for childbirth. But relaxin just doesn't target the pelvic area, it's your whole body. So you are at increased risk of injuring ligaments throughout your body when you are pregnant. What type of exercise can you do during pregnancy? This is a list of things that are generally safe. Swimming is good to do, brisk walking, stationary bike, specifically a recumbent bike, that's where you're more just sitting in a normal chair, low impact aerobics, some yoga. Running, the general rule of thumb is if you ran on a regular basis before your pregnancy, you can run through your pregnancy. Most people, by about month 6 or 7 of their pregnancy, are no longer running. It's just uncomfortable and it doesn't feel good. Contact sports should be avoided during pregnancy so you don't accidentally get your stomach hit. What should be exercise intensity during pregnancy? Moderate intensity. Your heart rate, as I was already telling you, is not accurate since your resting heart rate is elevated from normal. So I always tell my pregnant patients to use the talk test. If you're exercising and you can converse, say a sentence, you are safe. If you're exercising so hard that you can't really speak or say anything, you're overdoing it and you need to slow down, decrease the intensity. It's real important when you're pregnant not to overdo it. You shouldn't exercise and then be fatigued and worn out for the rest of the day. That means you're maybe doing a little too much. What exercises to avoid during pregnancy? After 4 months, you should avoid lying on your back. This is because the weight of the baby is pushing on one of your major arteries and it could impede blood flow and circulation. Excessive stretching of your inner thigh muscles, sharp twists, bouncing movements, inversion activities. That means activities where you're upside down. You should avoid doing that. And caution with isometric. Isometric means exercise where you're just statically holding a position. And what happens if we're holding a position, like you're holding a squat, oftentimes we hold our breath. So that's why you want to avoid isometrics, because you want to make sure you're breathing. A way you can counteract this is when you're doing any type of resistance training or holding a position or posture, you need to make sure you're breathing. So count out loud while exercising. These are all indications to stop. If any of this happens when you're exercising during pregnancy, you need to stop. If you're having bleeding, premature labor, dizziness, severe abdominal pain, unusual fatigue during or after exercise. This is your body's way of telling you, do not exercise. It's normal during pregnancy, especially towards the end, to sometimes get incontinence where you have some urinated leakage. You're carrying on a lot of extra weight of the baby. It's pushing down on your bladder. Your pelvic floor muscles can't compensate. So to kind of counteract this, it's important to perform pelvic floor exercises. Oftentimes they're called your Kegel exercises. Also, if you have a strong pelvic floor muscle, oftentimes your delivery is quicker and you can repair more quickly after delivery. It's important to have adequate strength and ability to relax your pelvic floor muscles. Postpartum exercise. Once you have the baby, you're considered postpartum. If you've had a C-section, you need to wait until the incision is healed and you're cleared by your OB doctor. That may be 6 to 8 weeks after delivery. Vaginal delivery, you will see your physician 4 to 6 weeks after delivery, and generally, if it's uncomplicated, about 4 to 6 weeks after delivery, they'll give you the green light to exercise. Let me just give a little note. Most people, 1 to 2 months after having a baby and taking care of the baby, don't necessarily feel like exercise, and that's okay. There's a time and season for everything. Diastasis recti is a condition that happens during pregnancy, and oftentimes it happens towards the end of the pregnancy where you get a separation of your abdominal muscle. It is considered normal, but what's abnormal is on some people it doesn't resolve on its own after delivery. So you can check for diastasis recti by lying on your back. You lift your head and shoulders off the ground, and you can look to see if there's a bulge in your stomach area. And in that bulge, if you can stick 2 or more fingers in the bulge, you do have diastasis recti. If you have diastasis recti, you need to make sure you avoid curl-ups or sit-ups, trunk rotation, leg lowering exercises. You're going to start with, after delivery of the baby, start with isometric abdominal exercise. That means where you're just going to kind of pull in your stomach, squeeze and tighten those abdominal muscles, but you aren't really putting any additional stress or strain on it. There's a physical therapist named Shirley Sharman who came up with some exercises. They're progressive exercises. They're called the Sharman exercises to help rebuild your core after pregnancy. So you can just Google Sharman exercises to find some videos about that. Here are some good pregnancy websites, babyfit.com and americanpregnancy.org. That gives you reliable information.